students that come here to Renaissance are students out of all of the junior highs and high schools in the Davis district that have committed safe school violations. And so they can't go to what I call normal school until they've gone through our program. For our service learning component, I decided that we would make blankets for the different hospitals. I have them cut them and get them the right size. Then somebody does the decorative edge on them. We punch little holes and crochet around them. I think the students here enjoy this particular opportunity, not only because they get out of class, but they get to see that people do appreciate them. I think it's important for these kids to see that for themselves that they have self-worth, that they can do something, they can do it well, and because of what they've done, they see this gratitude from other people. This grant is like getting gold. We do not get money for this project, and it takes a lot of stress off of me to be able to go and know I have money to go and get more fleece and more flannel to do these blankets, to be able to engage these kids that come to Renaissance in something worthwhile. A lot of times you don't see everything that happens with these kids until they've grown up and they walk through the door and say, "Do you know who I am?" "Yeah, I know who you are. I made it. Thank you for being there, for helping me." That's when you know that what you did, what you worked for and worked so hard to do, that it did affect them in their life and what they ended up doing with it.
The Kipper Foundation is a nonprofit organization that provides support to both children with autism, Down syndrome, and their families. One of the most difficult things about autism is that there's a huge spectrum. They go from high functioning, where they just have problems connecting with other individuals or understanding social cues, to really low functioning, where they have a hard time, they're nonverbal, they can't do basic tasks around the house. So one thing they all have in common is that they look perfectly normal. One of the main struggles that both the kids and the families feel is that they have no one to turn to. When they go out to do activities like camping or even the museum or the zoo, they're often met with a lot of hostility and frustration because the community doesn't understand the situation that they're in. So the kids need unlimited love and support from people who understand what they're going through. And the parents often need a break. They need someone to step in. They need someone to talk to who understands what they're going through. And they need other families that can relate to them, that they can discuss everything with. We provide all of this. Most of the time when they come in, they're really nervous and awkward, and by the time they leave, they're comfortable and happy, and it's a major difference. The Select 25 grant will help us set up the Kipper Camp. So Kipper Camp is a great time where the families can come and enjoy a great recreational time. Often we take them to a new facility where they can go horseback riding, have campfires, we do slip and slides, and at the end we always do a big fireside where they can do a talent show. This Select 25 grant is honestly going to save our organization right now. We've had a hard time gaining funding because not a lot of people really understand the needs that autistic children have. This is going to help us rebuild Kipper Camp and make it more successful than it ever has been. We're so excited and so grateful.
The Utah Society for Respiratory Care is a professional organization of about 1,400 respiratory therapists across the state of Utah. We're extremely involved in community education. When Ogden became the #1 in the nation for e-cigarette use, we determined that we had to do something about it. And when the legislation didn't pass last year for some sort of tobacco and e-cigarette specifically legislation, we said then we'll start from the bottom and go up, and decided we would implement a program called Breathe, which is an exposure for lung disease prevention and health promotion. Working with the YMCA, we've made it 3 one-hour sessions where we go over general anatomy and physiology and let them see a lung that's healthy and a lung from a pig that actually smoked. And tease with the children, you know, didn't really smoke, but once the lungs were removed, we had them smoking cigarette after cigarette. They get to really see how they don't inflate the same. They get a chance to interact. Then we tie it up. Every class builds on the other. We have skits. We actually create a big airway where some kids are mucus and some kids are the smooth muscle that constricts. They love that. But it culminates into that 3rd day where they actually are dissecting cow and pig lungs. And I think that probably has the most impact because they literally get to touch the lungs and see how spongy they should be in comparison now to the lung that we had that's diseased and how heavy and how it will not inflate. We have seen impact. We've been doing this program since 1995, so it's given us a good database. Just about a year ago, I received a letter from a child who's now not a child. He's 29 years old and he's in medical school finishing his residency. And he said, I just wanted you to know that I had plenty of opportunities to smoke, and there was smoking in my home when I grew up, but I remembered the difference in those lungs and I never picked up a cigarette. I can't tell you how much it's going to help us reach out across the state. And I just thank everyone at Select Health, Select Management, Select Health Directors, care managers, everyone who works behind the scenes to make this kind of funding to small organizations like the Utah Society for Respiratory Care possible. Together we can make it happen. We'll really make a difference.
Thanks for helping our kids breathe easier.
Common Ground is a nonprofit in Logan, Utah, and we provide outdoor recreation for people of all ages with disabilities. A Strider bike looks like a typical bike, except that it doesn't have any pedals. So pedaling is the same motion as walking, so kids don't need to learn how to pedal. What they do need to learn in order to ride a typical bike is how to balance. Riding a bike is such a typical activity for you and I. You know, when we were growing up, that's just what we did. We rode bikes around our neighborhoods with our friends, and you never really think about the kids that can't do that. And so to be able to provide something that these kids can be normal in, they can ride with their friends, and it looks exactly the same. And I think just the confidence that comes from that, from every one of these kids, is incredible. So we do a 6-week Strider camp in the summer where kids come and they train on these bikes for 6 weeks. We have our staff provide instruction so they can go home and ride these bikes. And then at the end of the 6 weeks, they get to keep the bike that they rode on, and they get to keep it for the rest of their lives and get to ride around in the neighborhood with their friends and get to show off to their classmates. Our grant from Select Health is going to purchase 30 new Strider bikes. So we are going to serve 30 kids with disabilities this summer, and each of those 30 kids is going to be able to take home the bike that Select Health purchased for them. To all the people at Select Health, I want to say you guys are changing 30 lives of people with disabilities.
About in 1992, a group of teachers and the Teachers Association began to notice the needs of students who were missing school because just of emergency needs that their families couldn't meet. And teachers are very sensitive and aware of students' needs, and so they formed this organization to try and help them. And the mission of Kids Cause is to keep children in school so that they can get their education. Teachers see all kinds of needs in their classrooms, but in particular needs that we can help them with would be if there was a vision problem, a hearing problem, a dental problem. Those kinds of emergency needs can be referred to our contact list of professionals. Sometimes the teachers say, this child needs a coat or boots or something that they can wear to school, and we can help in that way as well. Last year I think we served over 500 children, and that means children that have glasses that they can see, they can read with. That's children who have hearing aids, and so many of our children need clothing supplies. They need a coat, they need boots so that they can come to school. We don't want them ever to stay home because they don't have the right clothing or the right school supplies. So those are easy ways that we can help and we love to do that. We're really grateful to Select Health for recognizing our efforts and for being willing to assist us in the solutions that we're looking for to help these children stay in school and become educated so that they can be contributing members to our communities.
The Box Elder Community Food Pantry is neighbors helping neighbors. We just are helping those in our community with food insecurity. For our Select 25 grant, our purpose is to help buy shelf-stable milk and hygiene products for our customers. Milk is a very difficult item for us to receive in our pantry, and so the reason why we feel that we need milk in our pantry is that it is part of a balanced diet. It has the things that people need to survive and thrive. Also very important for our children. So we have made a deal with Gossner's in Cache Valley, and we are purchasing shelf-stable milk for our customers to have and then that way we can provide that when we don't have the cold milk, which we hardly ever have here in this pantry. One of the other things that we'll be using the Select 25 money for is to purchase hygiene items. I believe that having these items in our food pantry, milk, hygiene items, our canned goods, our fresh produce, helps this person to know that for the next 10 days, they are going to be able to have food to feed their families and their children. They're always very grateful. Our customers would be going hungry if we were not here to help them through those difficult times of food insecurity.
Because of you, there's less hunger in Box Elder County.
Families who need respite qualify at Friday's Kids. Their child has a special need or disability that makes it difficult for them to find care through regular means, and that they don't have any other support system to be able to help them out to get a break. The children here at Friday's Kids Respite come from all sorts of disability backgrounds. We have some that have more common, like Down syndrome and autism, to some rare genetic disorders. Our children at Friday's Kids range from ages 4 into 19. And we help children of all abilities. We have some that come in walkers and wheelchairs, some that are more able-bodied, that run through the halls the whole night. The parents that apply for this program are really exhausted. They've spent time in appointments, they've spent time with specialists, and they themselves need to take care of themselves. They need to have a moment to relax and to leave the responsibility to someone else just for a little while so that they can take care of themselves, so they can take better care of their child with special needs. We have a family that came in recently that have been waiting for respite, and the mother, went through the application process, and then it was time to say goodbye to the child, and she kind of had a hard time saying goodbye. But then when she came back a few hours later, it was like she was different. She walked a little taller. She had a smile on her face. And I asked her what she did, and she just went to a bookstore and just read a book and said that was the first time she had sat down to read a book in almost years. The Select 25 grant to Friday's Kids means that the community sees us as an important need for families, and we feel that support from Select 25 to know that respite is valued and that these families do matter and that you support that mission.
Panguitch is a community of about 1,500 people. Athletics in our community is a big part of the development of our youth. On a typical Thursday, Friday night, most of the town comes to whatever we're participating in on that night. And just because we're a small rural community doesn't mean that we can't provide the best opportunities for our girl athletes like so many other communities do with their male athletes. In starting up a program, you got to remember, everything's new. We don't have pants, belts, socks that can be passed down from year to year. That's all new. The jerseys, practice jerseys, warm-ups, all of those things. And so it's going to have a huge impact on starting a new program. Panguitch has typically been the town and the school that starts a lot of these programs. We have 4 other schools within a 55-mile radius that are also looking at doing softball. One of our good friends from the north, Paiute High School, they're starting softball this year. We have a couple of other rural communities that are developing their younger girls, and we believe that within the next 3 to 5 years we could have 7 or 8 schools in our region that are now playing softball, whereas Panguitch and Paiute are the first 2 in these rural communities that are starting softball this year. I think I can speak for the players, the coaches, and the community, and just a big thank you to Select Health. To have a $2,500 grant come in to help us get this program started is huge, and we really appreciate that, and want you to know that a lot of people are thankful.
Thank you, Select Health!
Kane County Victim Services is really the only organization in our entire county that's there for victims of crime. You know, Kane County is a beautiful place. A lot of people have been here on vacation to see all that we have to offer, but we're like any other place, and secret, terrible, horrible things are happening here just like everywhere else. One of the problems we have here is that because there's a lack of services, people don't necessarily feel comfortable disclosing some of the dark and terrible things that have happened. The Children's Justice Center model is really important because it focuses on the family and recovery. These kids have been in sometimes really deplorable conditions, and when they disclose, oftentimes that can be worse. The secondary trauma of disclosure can be even worse. In cases where family members have been the perpetrators, it's especially difficult for these children. Often they've been in conditions in their own home where they're not nourished or undernourished. And so for them to come to a Children's Justice Center and sometimes to be here for several hours and to also go without food, that can be part of that secondary trauma that we're trying to reduce. So this grant, where we're able to buy nutritious food for them to have at this really difficult stage, is going to really help those kids so that they're being healthy, being nourished, and further helping reduce that secondary trauma. The impact of this grant is actually pretty significant. We're a rural county where we have very little services. We have very few people that are doing their best to make things work, and so $2,500 is going to go a long way. It's going to help a lot of kids. It could be a multiple year situation where we're helping provide these nutritious snacks to a lot of kids for a while to come. On behalf of all the kids in Kane County who are moving on in their lives and moving on to recovery, I thank you. I thank you, Select Health, for this grant.
The Meals on Wheels program is a program that's designed to help older, frail, isolated older adults receive good nutritious meals on a daily basis. The Meals Plus program is a program that started last year in 2014, where we partner with Utah State University Extension Services, and we source and deliver fresh vegetables and fruit to our Meals on Wheels participants. The Jail Horticulture Program is one of the major partners that contributes to the fresh produce to the program. So the inmates have an opportunity to participate and feel as though they're doing something good, and participating in the program gives them that opportunity. They can see where their fruits of labor are going to support the Meals on Wheels individuals that receive our meals on a daily basis. During discussion with one of the inmates here, he had said that his aunt and uncle received Meals on Wheels. And I think that's just a correlation where our program and this program have really partnered to be able to contribute to the community as a whole. The $2,500 that we received from this grant will allow us to expand and support the program in a much larger way. We hope to be able to offer more and more participants the opportunity to participate in getting fresh fruits and vegetables.
The Seeger Memorial Clinic was founded about 27.5 years ago by Dr. Floyd Seeger and his wife Donna. And it is an organization that is here to take care of the homeless indigent working poor of northern Utah. It's a free clinic for everybody that comes. We just ask that they not have any other resources for health care. We see patients with acute illnesses, such as the flu or colds, sore throats. And we also see people with chronic disease processes, such as diabetes, hypertension, COPD, mental health. We started the diabetes clinic almost 2 years ago because we were seeing a lot of diabetic patients, and we realized there was a need in this community for homeless people in particular that had diabetes. We recruited a couple of physicians to run diabetic clinics. We brought in some diabetic educators to help them understand their diet. One of the challenges the diabetic educators have had is a lot of these patients eat in soup lines, or they eat out of dumpsters. And so they had to teach them based on whatever food that they could get. And so that was a different challenge. Last year we had over 2,000 patient visits, 2,200 patient visits, and we spent a total of about $14,000 total for the whole year. And so we are very frugal. We do a lot with a little bit of money. $2,500 is not a lot when you think of all of the things that a diabetic patient needs. But to the one patient that can get a job or can get into some low-cost housing or can help take care of their family, can stay out of the emergency room and avoid those costs, it means the world.
The Utah Down Syndrome Foundation is all about empathy and empowerment. Since 1977, we've worked to help people with Down syndrome reach their vocational and educational potential, and to integrate them into the communities and provide social relationships and opportunities for them. People with Down syndrome often have difficulty being accepted. When kids are younger, there's often a tendency to shy away from someone who's a little bit different. But children with Down syndrome are more alike the other children than they are different. And we like to stress this. Thanks to the Select 25 Award, we've been able to accelerate the development of a peer presentation toolkit. The kit is put together so that a parent can go into a classroom, a scout troop, a daycare center, a club, any sort of social setting that the child is in, and explain to their friends what it is like to have Down syndrome. There's an oven mitt, and we ask the kids to try and write their name, because this is the way Down syndrome kids who have poor muscle tone have difficulty writing. We have them try and speak with a marshmallow in their mouth, because sometimes kids with Down syndrome can't speak clearly at first. Others are hard of hearing, so we have them stick cotton in their ears and try that experiment. There's a book about Down syndrome. There's all sorts of games that we play with them to help them see that their friends are more like them than they are different. UDSF is very, very grateful to Select Health for selecting us to be part of their awards program.
Odyssey House provides substance use disorder and mental health treatment to youth, adults, and parents with dependent children. We treat everybody here at Odyssey House, whether they come from a really great background with all the support systems that a family might have, to people who have really struggled with their support systems. Their family might be disjointed, they may come from a background where financial stresses are severe. The teens that we see here at Odyssey House aren't your typical teenagers. They typically present with chronic health conditions such as heart problems and other lung diseases because of their drug use. Many of the teens that are coming into our programs don't come from backgrounds that are conducive to accessing health insurance and Medicaid and CHIP. So it's really important that we connect these teens with appropriate health care so that they can get routine well checks, they can get vaccinated, and they can start to learn how to appropriately use the healthcare system as they rehabilitate. Healthcare is very expensive. However, $2,500 does go a long way. If we can target teens earlier on so that they can get appropriate health care, we can really prevent chronic conditions later on in life. We're really excited to get this grant from Select Health for $2,500. We're going to use this to help teens get back on track with their physical health needs by seeing the doctor regularly, getting their vaccinations, and getting appropriate medications for their physical and mental health needs. Let me be the voice for all the teens that we're serving. When I say thank you, you're changing our lives.
Family Support Center is a crisis respite nursery for children in our community, and we do planned respite for parents if they just need a stress break or they have appointments they need to go to for up to 3 hours a week. And then we have crisis care for children to come for up to 72 hours if they are in danger for any reason or the parents need help. The Family Support Center is also a help to parents as they're learning how to be parents, that it can be a stress relief for them so that they can become better parents. I talked to a mom last night and she was so excited about our services because she said she just gets so overwhelmed that it's nice to know that there's an option for her to bring her kids somewhere where they can be safe, but she can also have a break and like regenerate herself and become a better mom for her kids. Last year we were able to provide over 14,000 hours of care, and that translates directly to healthier families and stronger relationships within a family with the children and the parents. I feel like the little time that they're here, it's not very long compared to the rest of their life, but we have such an opportunity to impact them and to give them a little sense of hope that even if things are hard, that life will get better and that they can remember that they were loved here. We are so grateful for Select Health and for them recognizing the service that we provide to our families here in Cedar City, and it helps us to be able to help more families and help more children.
Southeastern Utah Association of Local Governments, one of the projects we have is our community garden in Carbon County. The community service garden began with CAP Utah. Price City donates our land and our water, and the idea was to offer fresh produce to our food bank customers. Last year we produced 3,010 pounds of produce, and this year with the high tunnel and the beehive we're gaining, we should be reaching about 6,000 to 7,000 pounds. By having this community garden and producing 7,000 pounds of fresh produce, it offers over 2,000 people in our community the opportunity to select from fresh produce, who otherwise may not have that opportunity. We plan with the Select Health Grant to purchase a tiller to help maintain this large area that we have for this garden. The trellis will be a great addition as well. It will help with our cucumber plants. The grant will help us afford some signs to maybe identify community partners as well as people who adopt a row. And then when people walk in, they can be proud and see where and why we have all this support. This is a great opportunity to say to Select Health, thank you for finding us. Price, Utah is not a large community and not something that's anyone hears about a lot, and you found us, you gave us a great opportunity with this grant to improve lives, improve community support, and it's just exciting, and we just can't thank you enough for that.
Making it green in Price!
Clear Horizons Academy is a school that's there to help kids with autism. So the kids, they have a difficulty with what we call motor planning, to be able to think of the movement they want to move and then be able to have their bodies perform in that way that they're thinking. It takes a lot more effort. It's a lot more difficult for these kids to get the coordination down. Kids with autism, they need most of them, especially at our school, need a lot of physical activity. We call the term proprioception. It's kind of joint compressions, the senses within the joint. So any movement we can get, that compression of the joint, running, jumping jacks, picking up a ball, throwing a ball. Running also works with the vestibular system. It helps to calm their bodies down. So to go into PE and work on that coordination, if it's a gross, we call the bigger gross motor coordination, bigger movements, and do that and get their coordination down, then it's better for them to go back in the classroom and work with what we call fine motor coordination, the smaller movements, and get that coordination down. And it's all the motor planning between the brain and the physical body. And that's what we work on. That's what PE is going to help us with. You know, from Clear Horizons Academy, we can't thank you enough for the grant. We appreciate all the help, and these kids are sure going to get a lot from it.
The Learning Center for Families has a variety of home-based programs serving vulnerable populations in Washington County and along the Arizona Strip. By saying vulnerable children, what we're talking about is that either children who are vulnerable because of health conditions, some are born with conditions such as Down syndrome, others are later on diagnosed with conditions such as autism, but we also work with a variety of families where the children have not been diagnosed with any condition or concern, but the families are extremely at risk due to low income, mental health problems, homelessness, and issues like that. Home is the best place for a young child and their family to learn together. It's their home where they learn to be adults. It's their first part of getting ready for school. We can use everything in the home as part of that learning. Sometimes families struggle with feeding time. Sometimes families struggle with bathing and other kinds of just daily routine activities. And so we can set families up by problem solving with them and discovering ways that the child can be accelerated in learning just by being a child in the home. A lot of times people say, well, that's child development, and child development, that's a family situation. But the reality is that we're not raising children, we're raising the future. We're raising our workers, our consumers, individuals that are going to run our country, and we need every single child to be able to grow up as healthy and strong and supported as they possibly can be. They are our future and they count.
This is the first year of the Leader in Me program at Woods Cross Elementary. The aspect I focused on in the grant was the sharpen the saw. They got the idea of sharpening the saw from a man who was trying to sharpen a saw, and somebody said, why don't you sharpen that saw? You can get more done. And he said, oh, it takes too much time. And he said, and then they realized that after that, he would be able to actually cut more if he took a little bit of time out to sharpen that saw. And I don't think we're doing that enough in the public schools. When I heard about this program driving to work one morning on the radio, I thought this would be the perfect balance to what my students are expected to be: rigorous activity academically. And so we know that having physical activity in the classroom, actually just 2 minutes of heavy activity that's rigorous, would actually help the brain for a half an hour. So our goal is to sharpen the saw by having more activity outside, inside, the teachers as well, so that all of us can be happier and healthier. The behavior changes I see are that the children are so much more focused when they do begin their activities, and being in front of the computer is not as boring as it is all the time. It also just gives them a chance to breathe deep and feel like they're doing something just as important as doing the academics. And I think these habits will help them their whole lives. It's amazing to me that out of all the people you could have chosen, that you found us in this little corner of the world and found a specific need to take care of that we really need in this school. So thank you very much.
The Polizzi Clinic provides psychiatric services to those most in need in our community, the uninsured and the low income. So all of our patients are within 150% of federal poverty guidelines for their household income, meaning they really can't afford to go out and pay for a psychiatrist or pay for a nurse practitioner to see them and provide the medications that they need to be stable, to get back on their feet and get back on with their lives. Most of the patients at the Polizzi Clinic are dealing with serious mental illness, serious depression, severe anxiety, symptoms that really get in the way of daily living. Access to medications is critical because mental illness is very treatable, and we have in our community medications that can really make a huge difference in a person's life. Patients are remarkably resilient. It's incredible the condition they come to us in, and yet they're still functioning, they're still taking their kids to school, they're still going to work, they're still trying to hold things together, yet they're dealing with symptoms that most of us would be devastated by. And so it's incredible and so rewarding for us to be able to watch the transformation they're able to go through once they simply get access to the medications they need. Some of our patients are already on the medications they need, but they run out of refills and they can't afford to go back to the doctor that prescribed them, and they stop taking them. And so with psychiatric medications, that can cause a lot of different symptoms, side effects, and problems for them. And so it's so easy for us to be able to give them access to those medications that were already working, that were already providing them with the quality of life they needed to move forward. The Select 25 grant is going to make a huge difference in our patients' lives. We utilize patient assistance programs to help our patients get access to medications through the pharmaceutical companies, and we also utilize generic prescriptions to help patients who don't qualify for patient assistance. But even a generic payment of $4 or $5 a month can really add up if you're on 2 or 3 medications or you simply just don't have the income to pay for that. So the Select 25 grant is going to go toward our patients who don't qualify for any other resources and don't have the financial ability to pay for their medications to be able to access those medications while they get back on their feet.
Family Connection Center Food Bank is the largest food bank in Davis County. We serve all of Davis County and Morgan County. We do 4,000 unduplicated individuals a month. Family Connection Center started our backpack program in September of this year. Unfortunately, when people are what we call food insecure, it goes unnoticed, especially kids. So we decided to, through Utah Food Bank, partner with the Title I schools and take referrals on kids that teachers were finding out the last time they had a meal is lunchtime on Friday is their free lunch. The backpack program is important to Family Connection Center because we don't want our children to go hungry. They're our future. If they're not eating properly, they're not learning about nutrition when they're younger, they're not doing well in school. They're going to pick up bad habits. So basically, by giving them food for the weekend, they're not food insecure, they're not worrying about where their next meal is coming, they're able to make better decisions, and they're there bright and early on Monday morning. I think the #1 thing that the backpack program has brought to the forefront in fighting poverty is there's a lot more children that go hungry than we ever realized. We had kids that once they started the backpack program, they started coming out and saying, we didn't eat since lunch on Friday. Can I have more because I have a sister in junior high? Can we get more food? How can we do this? The kids started opening up about their hunger, and that just made us realize we have to get a lot more backpacks out there. The thing I'd like to say most is thank you, but most of all, I'd like to thank you from all the children that aren't going to go hungry over a weekend. And you have no idea the advantage that them having nutritious food in their stomach makes for them in life.
So Healthy Happy You is an after-school program. It's for kindergarten through 6th grade, and we're here at Panguitch Elementary School. It's for boys and girls. It's a free program. It's Monday through Thursday. We start right when school gets out at 3 o'clock, and we run until 5:30. It's mostly focused for kids who are at risk of going home alone and being latchkey kids. Some of the successes we've had with our program, for example, we have a young lady who's been coming, she's in 6th grade this year, and she and I have said that a few times that this is her last year, but she could come back as a volunteer when she's in middle school. She's really changed a lot in the last few years. She's had a chance just to make new friends, come outside of her shell. She's a terrific teacher helper when she's with us, and again, improved her way of thinking and working and looking at the world. We're not exactly sure where these kids are going to go in life. Having a program like this is an opportunity for them to learn and grow, because one day they could come back and be a doctor in the community, you know, a firefighter. They're going to be our teachers, and that Select 25 grant is really what's going to help to shape that future.
Hope for Utah is a nonprofit organization that is dedicated to suicide prevention, intervention, and postvention. Suicide is a challenge for us in the state of Utah. For ages 10 to 17, we're 9th in the United States out of all 50 states. You know, one of the things that I love about Utah with resources for suicide prevention is every county has a mental health agency, and then there are a lot of private providers and other organizations that are available to help families. And then, of course, what we have within the school, which we call Hope Squads, peer-to-peer prevention program where students are trained to reach out and recognize those students who may be struggling and then work with them to get them to a trusted adult. Last year we had 34 Hope Squads throughout the state of Utah with about 250 students who were referred for help, and about 18 of those students were hospitalized. This year we have 130 Hope Squads from St. George to Brigham City, from Tooele out to Uinta. And we have almost 2,500 students that every single day go to school, watch out for their peers, and provide help and support. These are great young people who are trained and taught not to be a therapist or a counselor, but to be a good friend. And so far this year we've had over 500 students referred for help. So we see the need and the importance of having something like this in the schools. $2,500 may not seem a lot to a lot of people. The reality is it's a lot to us. The ability we're going to have to train that many more advisors and to bring that many more students on board will definitely save lives. We will be able to impact more individuals across the state of Utah that we were never able to impact in the past. I would like to say thank you. This is a great honor for us to be selected. There are great organizations across the state that do great things, and for us to be considered along with some of those is quite an honor, and we're very grateful.
The Murray Greenhouse Foundation is a day program for disabled adults. At age 22, disabled adults, they age out of the school system, so that becomes a crucial time in both theirs and their family's life because they aren't able to continue that social outlet they have. So as parents, we came up with this idea to start this program. In our greenhouse, we grow vegetables, herbs, flowers. Our big selling point is heirloom tomatoes. The benefits these kids get, there aren't words. They're my kids now. After 6 years of being open, we've been open 6.5 years, and they're my kids. And there's not one of them that I don't love. And they each bring their own special personality and their own special needs. We've got from wheelchair bound to fairly high functioning, some that actually ride their bikes down here. They live in an apartment and still need that place to go every day to feel part of the community. And the benefits, hopefully, is that they're happy. If I could say one thing to Select Health for choosing the Murray Greenhouse out of probably hundreds and hundreds of applicants is thank you. We feel so blessed. It just overwhelms me that people care about such a little program as ours and actually search us out and find us and know that we need help. There aren't words to say how grateful we are that you found the Little Murray Greenhouse Foundation.
Community Action Services and Food Bank is an agency established to help people in need. We foster self-reliance in individuals and families who are struggling with the challenges of life. The effect of hunger on children's performance is probably something we can all relate to individually as we think about maybe times in our lives when we've been particularly hungry. It's really hard to be able to focus or think about anything else. The nutrition packs we've observed are very appreciated by kids because it gives them food that they need. It's simple to prepare items like Easy Mac or the Easy Raviolis. Often they are in a situation in their homes where there isn't somebody to cook and prepare a meal and do those sorts of things that might be the case in other family situations. So providing this food in this manner does help kids and we believe makes a difference for them. The dollars that go into helping kids, I think, come back to us many times over as those kids grow and become successful members of our society and communities. Thank you, thank you, thank you. And I would really like to pass on the thanks of the clients that we serve. It is very typical every day for all of us who work in the food bank to get hugs, thank yous, expressions of appreciation. But the honest truth is we could not do what we do here if it were not for great organizations such as Select Health that support our efforts and allow us to do what we do.
PJ's Forgotten Children
is a charity that is run by all volunteers and all donations. We help children that have been touched by mental illness in any way. So it could be a parent that is in treatment, or it could be a sibling that's in treatment. We don't discern whether the child has mental illness or not. If it is touched in any way by a family member, then we want to help that child. PJ's Forgotten Children offers many kits. One is our school kits, full backpacks with school supplies. Another one is our hygiene kits. We also provide art kits and infant kits for mothers that are in treatment. Throughout the year at PJ's Forgotten Children, there is a great spirit of love and giving. We truly have a desire to pack each one of our little kits with love and tenderness so that the child will feel that someone cares about them when they open that bag. I've been here for almost 12 years. And the spirit here is so strong and so giving. And where else can you go this day and age to see the best in people, to feel the best in people? Every day that we come here, we see goodness. And it wears you out, but it fills you up. And that's why I'm here and continue to come back.